You are dealing with severe premature ejaculation and you are searching for a treatment which is non-surgical and effective. This video is just for you. Watch till the end. Hello everyone, this is Dr. Basha. I am consultant andrologist in Istanbul. In this video, we will be talking about selective dorsal cryoablation, which is effective and non-surgical treatment of premature ejaculation. Before starting the video, this channel and the subscribe is for free. If you want to have more data about and more knowledge about the sexual health, please follow us and learn much more about your sexual health. Let's talk about the treatment of premature ejaculation. As you all know, premature ejaculation is the most common male sexual disorder. 1 of 3 men has premature ejaculation in their life. Premature ejaculation has many different types. Some has primary premature ejaculation, which is lifelong premature ejaculation. Someone can have acquired secondary premature ejaculation, or sometimes it can be subjective. It can be changing up to your conditions. You may have premature ejaculation with one partner, or you may not have with another one. This is something different, and we have many treatment options for premature ejaculation. In first step of treatment, we can use medical treatments. We can use drugs, we can use sprays or creams, or if you don't get benefit from medical treatment, we can do psychotherapies and behavioral treatments, and there are other surgical options. Today, when we are doing minimal invasive interventions for the premature ejaculation, I will talk about one of the most effective treatment for premature ejaculation, which is cryoablation. What is cryoablation? Cryoablation is done with a special cryoprobe which gives minus 80 degrees Celsius cold to our nerves in dorsal part of penis. Penis has dorsal sensor nerves on the upper part of the penis. There are 5 to 6 nerves on the right part of the penis, and there are 5 to 6 nerves in the left part of the penis. These nerves are different from the erectile nerves. This is just for the sensation coming around when you enter vagina. With the arising from the glans penis, we have a nerve bundle on the upper part of the penis. We are trying to ablate some of nerves with the treatment, with the cryoablation treatment. This is one of the most effective and easy treatment for premature ejaculation. How it's applied? When we decide up to your clinic, if you have hypersensitivity in the penis, we are doing some measurements, and after that we are deciding to treatment with the cryoablation. We are doing local anesthesia. After local anesthesia, with a tiny cryoprobe, we insert the probe into the penis and we find the nerves in the penis by neurostimulation or by sensation. After detecting the nerves in the penis, the sensor nerves, we are freezing them up to 80 degrees Celsius. It's important we are applying it for 5 minutes for each nerve. We are freezing just around 4 points in the penis dorsal part, and after 20 minutes of treatment time, you are free. After that, you can have your sexual life immediately. At the same day, you can have sexual life. There's no need to cessate sexual intercourse after this treatment. And we know that if a man has latency time less than 2 minutes, these treatments are effective around 90%. And we know that there are many mechanisms can interfere with the premature ejaculation, and when we treat this trigger point in the penis, when the sensation, the start point of the sensation, when we freeze, when we ablate the nerves, we can have 90% control for the man after the treatment. It's really very important because before we were just having the surgical treatment for selective dorsal neurectomy surgery for premature ejaculation, but by the help of the technology, we can now have the treatment just like cryoablation to ablate the nerves to have better control without any surgical treatment. When we hit the nerve with the cryoprobe, we know that there is the process of degeneration and regeneration starts, because when we put the probe covering the sheet of the nerves start to degenerate. We call it Wallerian degeneration. Wallerian degeneration and regeneration again starts and stops in just like in 2 years. For 2 years, you will have better control for ejaculation. From my experience, this is a slow process. Degeneration and regeneration is a millimetric process, and so after 2 years, you will have slow by slow control of your ejaculation. Many of my patients, after 2 years, they don't turn back to their original time. For example, they started with the 1 minute, we brought them to around 10 minutes, and at the end of 2 years, they stop around 5 to 6 minutes, because we know that after 2 years, men will have better psychological control, better self-confidence, and after after that, and of course by the help of this organic process, they will have better ejaculatory control. Of course they will not stay at the 10 minutes, but they will be in a better state, which is enough for many of my patients. Around 80% of my patients after 2 years, they don't want to repeat the procedure because of this healing process. If you are getting premature ejaculation, if you have many psychological and sexual and familiar marriage problems with the premature ejaculation, you can contact my team and learn much more about treatment modalities.